morning guys, my name is Francis. I'm your clinical instructor for today. I am going to be demonstrating how to perform wound care. Assessment. Number 1. Identify the patient using at least 2 identifiers. You have your name and you have your birthday. This is to verify if you have the correct patient. Good morning, sir. Unsay pangalan nato, sir?
Carl Quintanar,
Birthday, sir?
December 27, 2005.
Okay, correct. Thank you. Number 2. Review orders for irrigation and types of irrigation solutions used. This is done to confirm the doctor's order for irrigation and what specific type of solutions to be used for the patient. So we have here a doctor's order to do wound care using normal saline solution. Number 3. Assess the patient's level of comfort and provide analgesics 30 minutes before the procedure. This is done to promote comfort for the patient, and since wound care can be painful, you can administer or provide analgesic to alleviate the patient's pain during the procedure. Sir, kumusta atong paminaw, sir? Wala ba nagangot-ngot ang samad? Wala. So sir, lipiuhan man nato imuhang samad, no? So maghatag lang tadaan og tambal kay pag limpyo nato ani medyo masakit mo gud siya, so kani makatabang siya para dili siya kaayo ng sakit. Sige. Number 4. Review medical records for patient symptoms related to open wound. This is done for you to have an idea on what to assess on the assessment to be done on the patient's wound. So reviewing record of the symptoms of the patient's wound. We have here patient experiencing pain with pain scale of 6 out of 10 with a characteristic of knowing pain. Number 5. Assess patient's history to allergies, especially to medications, to antiseptics, and to dressing materials. This is done to ensure safety, especially if the patient is allergic to, let's say, latex gloves or the adhesive tapes that you will be administering to the patient. So you have to assess for allergies. Sir, naa ba kay mga allergies sa gloves? Kung mukhaong kag saging, allergic ba saging? Kanang mga tape, sir, kanang mga dressing, kanang mga gauze nga ginagamit sa imuha, allergic ka na?
Dili, sir.
Sige. Planning. Number 1. Identify expected outcomes. This is done to be able to know the possible outcomes during the procedure and after the procedure. Number 2. Administer analgesics 30 minutes to 45 minutes before the procedure if needed. Like I said before, so administering analgesics is important to alleviate the pain experienced by the patient during wound care. Sir, mag-inom taog tambal para dili siya magsakit kaayo habang ginalimpyuhan nato imong samad. Number 3. Educate the family and patient about the procedure. Educating the family and patient will be able to elicit cooperation from the patient and will be able to establish rapport to the patient. So sir, bali ang buhaton nato karon no is limpyuhan nato imuhang samad, tanggalon nato ning daan nga dressing, then nato siya i-irrigate but pasabot ato siya kanang paagasan og kanang solution, no, para matanggal ang iyang mga nana, mga exudate. Then ato na pud siyang i-dry ug gahon nato siya. Then ato na pud siyang tabunan og bag-o nga dressing para limpyo siya, para gwapo ang iyang healing process. Okay?
Yeah.
Number 4. Gather appropriate supplies. Organization of equipments promote time management. So we have to gather the equipment necessary. So we have here the normal saline solution. We have our kidney basin. So if you don't have any kidney basin, you can make use of any Tupperware or container that you have. We have our syringe with the angio catheter. We have our cotton buds for getting a specimen. We have our waterproof underpad. And then we have our biohazard bag, our dressings. So if you don't have any dressing or gauze, you can use you can make makeshift dressing from bond paper. And then you have your pen for documenting and writing date on the dressing. Also, we have bandage tape. If you don't have the bandage tape, you can use of any available tape in your house. And then we have our PPE composing of our face shield, our gloves. We have our mask and our apron or our gown. So those are the equipments needed for our procedure. Number 5, provide privacy, perform hand hygiene, and position the patient appropriately. This is done in order to provide dignity to the patient, to avoid others seeing the patient during the procedure, performing hand hygiene to prevent the spread of microorganisms, and positioning the patient appropriately promotes comfort for the patient. First, dyan sa natong pultahan sir ha, para walang makakita sa imo ha. Then maghugas sa kamot bago ka magsugod. Implementation. Number 1, perform hand hygiene. This is done to prevent the spread of microorganisms. Hugas sa kamot bago ka magsugod. Number 2, forms a cuff on the biohazard bag and place it near the bed. This is done in order to collect the waste and also to prevent spillage from the irrigation. Number 3, applies PPE, uses sterile precaution if needed, discards old dressings and gloves, and then performs hand hygiene. This is all done to prevent the spread of microorganisms. This is the PPE, but for demonstration purposes, I will be removing my face shield and my mask so that you can view me while I am explaining. Number 4, applies clean gloves and then performs wound assessment. In assessing the wound, you can follow the acronym or the mnemonic COCA. So you have to watch for color, odor, consistency, and amount of drainage. After donning clean gloves, you have to assess the wound. Sir, sakit ba? Okay. You have to assess for signs of coloration. You have odor. We have consistency and amount of drainage. Okay. Number 5, expose the area near the wound only. This allows to preserve the dignity of the patient, provides privacy, and only the needed exposure to the patient. So first, we have to remove the old dressing by peeling off the adhesive to the skin by gently tugging it. Sakit, sir?
Yeah.
Okay. Tanggalan nato ni sir ha, para risdan nato. After that, you have to assess the dressing. So we have here slight bleeding from the wound, and then you have to dispose the old dressing properly into the biohazard bag and remove your old gloves to prevent contamination. Number 6. Irrigates the wound with wide opening. Fill the syringe with irrigation solution. So there are different kinds of irrigation solutions used for this procedure. You can use nasal saline, lactated ringer, or antibiotic solutions. So sir, ato ni siyang ibutang diri ha. Tabunan na nato ning imong lawas so kanila ang ma-expose. Then atong butangan og waterproof underpad sa ilalom para pag irrigate nato unya dili mabasa imong bed, no? Then butangan na po nato siya og kidney basin sa kilid para mo ni siya mosalod sa tubig, no, or sa irrigation nga atong ibutang sa sa imong samad. Next, attach a 19 gauge angiocatheter to the syringe. This will allow you to provide approximately 15 psi of pressure used to irrigate the wound. Sir, mag-ano lang ko sa irrigate. So bali ako ning pasiritan o kanang kaning solution para malimpyo imong samad. Okay? So continuous lang atong flow para matanggal man ang mga nana, no? So sa ibabaw, then sa over the wound. Okay? Para gid malimpyo ang imong samad. Next, hold the syringe above the upper end of the wound and over the area being cleansed. So in cleansing, you cleanse you apply the irrigation from least contaminated to the most contaminated area. This prevents the spread or the contamination of the wound site. Next, flush the wound with continuous pressure until the drainage is clear. This is done to continuously irrigate and flush the wound and remove the exudates. Number 7. Irrigates deep wound with small opening. First, you attach a soft catheter with a filled syringe. This is done to facilitate access in the small opening for flushing of the wound. Next, inserts the tip of the catheter into the small opening, then flushes the wound using slow continuous pressure. This prevents a splashing of the irrigation solution. Next, pinches off the catheter below the syringe while in place. This helps secures the catheter in place while irrigating. Next, removes and refills the syringe, reconnect the catheter, and repeat irrigation until the drainage is clear. Number 8. Applies clean gloves and cleanses wound with handheld shower. Performs hand hygiene, applies clean gloves, and adjusts spray with patient seated and ensures that the water is warm. You have to ensure that the patient is seated in order to prevent slips and fall, and make sure that the water is warm to facilitate proper irrigation and removal of the exudates. Sir, check natin kung okay lang kainit sa tubig. Okay lang?
Okay lang.
Next, shower the wound for 5 to 10 minutes. This allows adequate time to cleanse and irrigate the wound. Number 9. Obtains culture after cleansing with non-bacteriostatic saline when indicated. This provides sample for the lab for further analysis. Sir, magkuha ta og gamay nga sample sa imong samad ha. Ato ni siyang ipadala sa laboratory para mahibal-an kung kumusta na imuhang samad, kung nabay infection or paayo na ba siya. So, mo na siya ito ato ang sample. Number 10. Dries wound edges with gauze and dries the patient. This prevents further irritation of the patient's skin. Number 11. Applies appropriate dressing, labels with date and time, and student nurse's signature or initials. So this allows you to record when the dressing is done and when the dressing is due for change. So nahuman na taog limpyo sir, so ato na siyang tabunan no o bag-o nga kuan kaning dressing. Pahawid lang ko dire sir. Pahawid ka dire. Butangan nato siya og tape no. Para ma-secure siya. Tapos sugatan na ako ni sir og date ug oras karon. So tapos butahan po na ako og initial na ako para makabalo sila ko kinsa ang nagbutang ani. Okay? Number 12. Remove your mask, gloves, and gown. This is done to prevent the spread of microorganisms. Number 13. Dispose equipment and soiled supplies, removes gloves, and performs hand hygiene. Again, the rationale for this is to prevent the spread of microorganisms. Sir, tanggalin natin ni sir ha. Okay, pahumanay naman ta. Evaluation. Number 1. have the patient rate the level of comfort. This is done to assess the level of comfort of the patient after the procedure. Also, this allows you to identify any further needs of the patient. Kumusta man imo ang pakiramdam, sir? Okay lang ba ang imong kamot? Di nagamot-ngot?
Okay naman.
Number 2, monitors type of tissue in the wound bed. This is done to evaluate the status of the wound. Usually, an epithelial tissue seen in the wound bed signifies that it is a healing wound. So, based sa ato ang nakitaan kaganina, sir, sa paglimpyo, no? Naa naman kay ginatawag na epithelial tissue or kana ganing pamatuod nga hapit na gani nagaayo ang imuhang samad. So mga pila na lang ka simana, so padulong na siya maayo. Number 3, inspect dressing once every shift or as ordered. This is done to assess the dressing for drainage or the need to change the dressing. So sir, pag human ani, i-inspect lang na ako ni siya, balik siguro after pahumanay na akong shift, tanaw nato kung napuno na po ba siya og dugo or kailangan na po ba nato siya alisdan, or kung depende po sa doktor kung gusto niya ipatanaw ang imong samad every 4 hours. So every 4 hours nato i-check ang imong dressing. Number 4, evaluate peri-wound skin integrity. This is done to assess the skin surrounding the wound because frequent application and removal of adhesives can cause damage to the surrounding tissue or skin of the wound. So, tanawan po nato ang kilid sa imong samad, sir, no? Ang panit sa kilid niya. So makita nimo nga okay man siya, wala siya na damage, no? Kasagaran man gud kay medyo masamad siya tungod sa kanang sige tanggal gani sa tape. So far, ang imuhang kamot okay raman, so walay samad.
Sige, thank you.
Number 5, observe for presence of retained irrigants. This is done to make sure that all irrigants are dried off and removed to prevent skin irritation. So check nato, sir, ha, kung napabay nabilin ng mga irrigant solution o napabay magbasa-basa. So far, okay naman, nauga naman, natanggal na nato tanang solution. So para dili ma-irritate imong panit. Recording and reporting. Number 1, record procedures performed and all findings in the patient's chart. This is done to record accurate documentation and implementation of the interventions that you have done. So, record the procedure performed. So, wound care done around 7 a.m. Findings, we have shows epithelial tissue, so wound healing is present and no complaints of pain. Number 2, report to the healthcare provider any signs of bleeding, increase in pain, retention of irrigants, and any signs of shock immediately. This is done to be able to provide continuity of care for the patient. Sir, nagasakit ba siya, sir? Or kanang nagangut-ngut ba siya?
Wala naman.
Wala, okay. So ingna lang ko, sir, kung nagasakit siya kay ato siyang i-refer sa sa imong doktor, no, para matagaan siya o kanang tambal o ma-check up siya sa doktor.